South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's,
where kids come first.
Greetings and welcome to our latest Let's Talk Children's Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS Children's, thank you for joining us. Now, there's no denying that parents benefit significantly from education on child health. It empowers them to make informed decisions and foster healthy habits in their kids, leading to improved overall well-being. That's why STHS Children's hosts these monthly Let's Talk Children's Health webinars. By providing insights on common health issues affecting kids, parents and caregivers can prioritize their children's health. Now, in this installment, we'll be talking about allergies and asthma in children. Typically starting in childhood, allergies and asthma are the most common chronic diseases among kids in the U.S. per the Asthma and Allergy Foundation of America, with 4.9 million kids suffering from asthma and about 18.9% of children suffering from seasonal allergies. While neither asthma nor allergies can be cured, the symptoms can be lessened by tracking triggers, taking medication, and working with health experts to determine an action plan when an attack does happen. So to learn more about allergies and asthma in kids, we're joined by Dr. Santos Cantu, the Medical Director of the South Texas Health System Children's Emergency Department. Dr. Cantu, thank you so much for joining us.
Thank you, Tom, for having me. I appreciate it.
Now, when we talk about asthma, about 1.8 million kids end up in the ER after an asthma attack per year, while when it comes to allergies, about 10 million kids end up in the ER with severe allergic reactions. Is that something that you see commonly here in our ER at STHS Children's?
Yes, indeed it is. We see quite a few kids with asthma, and as a matter of fact, we have particular ways of treating children with asthma in the emergency room that are much different than how you would treat them at home. We also have quite a few children that we have to actually keep in the hospital, for several days until they improve. But we're very familiar with taking care of children with asthma.
Now, these kids that come into the ER with asthma, what percentage of them would you say that their parents maybe didn't recognize the early symptoms of asthma until this attack is happening?
Mm-hmm. That's a good question, actually. Probably the first time that they bring their child in, they didn't quite recognize it. And that's one of the things that I'll do, that the other providers will do, to teach the parents, what to look for, when to get concerned, and when to be concerned to bring your child into the emergency room.
And these are conversations that you should be having with your pediatrician if you're noticing any sort of symptoms, any kind of wheezing or any of those things, just because that will give you the education you need to already be doing whatever you can to protect your child's health, right?
Yes. And generally, once the kiddos with asthma start coughing, that's probably around the time when you should start initiating, further treatments with your child. And then, once it gets to a certain point, hopefully you won't have to, but sometimes you will have to bring them in to the emergency room.
Mm-hmm. And when it comes to allergies and the severe reactions that people may have, what are the kind of cases that you see when it comes to those severe allergic reactions?
Yeah. Well, many times with the allergic reactions, we'll see kiddos come in with just bad rashes, hives rashes. The worst scenarios would be where they're also having trouble breathing, or they're vomiting, or they're having, issues with their blood pressure. That's a very rare event, but it does happen. Probably more commonly, Thomas, is we'll see the ones with a lot of rash, and we have ways to treat that to make that better.
Mm-hmm. And then obviously education is really important. I know you've put together a great presentation for us, so let's get started.
Okay, thank you, Tom. Let's get started here. So basically, the first thing to talk about is asthma itself. As Tom said earlier, it is definitely one of the more common chronic diseases that we'll see in childhood. Over 9 million kiddos in the U.S. have been actually told that they have asthma. Okay, so it's fairly common. When we make the diagnosis, there's certain things that we'll look for. Generally, we like for them to be older than 2 years old. Many times there's a history in the family of, the mom or the dad has asthma or the DO has asthma. The kid themselves has other signs of allergies like dry skin rashes, which some people will call eczema or atopic dermatitis. And then some of the kids have wheezing, which is a noise that they make when they breathe out, okay? Wheezing, sometimes if they have wheezing when they're not having any other cold symptoms or anything else, that's a sign of a child with asthma. And we'll definitely see asthma more commonly in boys than in girls, a slightly higher rate in boys before they reach puberty. The main symptoms that we'll see with asthma are coughing and wheezing, okay? Generally, the kids are coughing. You can't really have any asthma unless you're coughing. And that's by far the 100% symptom with asthma. Sometimes the cough will be seasonal. In other words, you get to certain times of the year where certain pollens are out. You'll find that your child will cough just during the spring, or they'll cough just during the summer. And sometimes it's a sign of seasonal asthma. And sometimes the kids that are coughing for a long period of time, you can't figure out why are they coughing? They've been coughing for months and months and months, and you give them treatments for asthma, and it actually does make it a little bit better. And then the other symptom we'll see is wheezing. And wheezing is a noise, like we said before, it's a noise that they make when they breathe out. It's not a noise they make when they breathe in. And that noise that you hear generally from the chest is something that we'll see with asthma. The other symptoms, like we mentioned already, that can tend to be seasonal. Lots of pollens out there will trigger asthma. In the early spring, we'll see it from the tree pollens. In the summertime, from the grass pollens. And in the fall, from many of the weeds that create pollen, we'll see certain kids will have symptoms during those time periods. And the other one to consider is mold. Some homes will have mold in their house, and that tends to make asthma symptoms worse when it's humid outside, or if the humidity is high in the air or in the house. Some of the precipitating factors that we'll see, usually asthma happens gradually. It doesn't usually happen all of a sudden. There definitely are some kids who will have symptoms of asthma that happen very suddenly, and those are the ones that can get very sick. It's uncommon, but we will see that. And but as long as you know what to look for, to give you a clue on when to bring your child into the emergency room, then you should be okay. Respiratory tract infections tend to precipitate asthma. We're seeing a lot of kids right now with the flu or the other viruses that can tend to trigger asthma symptoms. Exercise is a common cause of symptoms. The kids who are running around and coughing, with lots of running around, it tends to be from asthma. Now, just understand, if you notice that's something that you should address with your doctor, because every child should be able to play any kind of sport or engage in any kind of physical activity without having issues with their asthma. Okay, and there's ways of your doctor should have ways to help with that. The weather can be a precipitating factor. Cold weather tends to make asthma worse. Changes in the weather, go cold to hot and hot to cold, tend to be another thing. Tobacco smoke is actually a very, very big risk factor for making asthma worse. Vaping, usual household allergens like dust mites, cockroaches, pets, in particular cats, rodents, irritant exposures like paint, perfumes, and cleaning products can bring out asthma symptoms, along with some stress in the older kids. Okay. The diagnosis of asthma, we like to see several things. Generally, your pediatricians would like for them to have some testing done to make the diagnosis, but it's kind of limited by the age group. So if you're under 5 years old, you're not going to be very likely to be able to blow into a device that they use to measure your airflow. But once they reach that age, many times your doctor will send you to get those that kind of testing done. When we can see asthma symptoms get better with medications that help with asthma, such as albuterol or Atrovent. That's a clue to us that you probably have asthma. And then obviously we want to make sure there's nothing else going on that may be causing asthma. And the treatment of asthma, generally, the more common medication that is used is albuterol. And albuterol actually helps open up the lungs. Okay, so with asthma, your lungs get very tight and they get they kind of close off a little bit. And the albuterol will help open up those lungs and to help with the wheezing. Okay, when the wheezing gets really bad, there's actually a lot of inflammation inside your lungs. And so we treat that with the steroid medicines that you generally can take by mouth. And the asthma basically is two things. It's the airways becoming closed up, and it's also a lot of inflammation. And so we treat that with medicines that help open the airways and medicines that help with the inflammation. Now, there are some patients that have more frequent symptoms, and they might be on a daily medicine, usually twice a day, a daily steroid inhaler. And so sometimes that medicine is actually intended to keep you from getting an asthma attack. So that's something that you take twice a day, every day, and then you will take the albuterol just as needed. And then there's some other newer therapies. They're called smart therapies. They're intended for patients to only have one inhaler and to use it, in a particular way if you start getting more sick with your asthma. And that's something that your doctor would talk to you about. And then if you do have to come to the ER, hopefully you won't have to do that. But we have different ways of administering these medications, oftentimes much, much more frequently, but in a very supervised manner. It's nothing that you should be doing at home, okay? All right. You want me to talk about allergies? Or?
Let's talk allergies.
All right. So in allergies, with asthma, they almost are always secondary to people who have allergies. And usually the allergies, we'll see those in kids older than 2 years of age. When you look at a child with allergies, you'll see certain things on their, kind of in their upper respiratory area. You can see what we call allergic shiners, or the dark spots underneath your eyes. You'll see a crease along their nose, which they get from, pushing up on their nose and clearing their nose with their hands. Lots of runny nose, swollen eyelids, swollen conjunctiva, which is the pink part of your eye. And a lot of things that can happen from allergies would be allergic pink eye, which is, a pink eye that's, very, very itchy on your eyes. Sinus infections. Sometimes if you have a lot of allergy symptoms for a prolonged period of time, more than 2 or 3 weeks, sometimes that can turn into a sinus infection. And obviously, asthma can come along with the allergies. And then the other one is eczema. Eczema is a rash that we have ways of treating that also, okay? And then the last thing, as far as the treatment for allergies, there's plenty of medicines that we use. Most of them are antihistamines, such as cetirizine, loratadine, diphenhydramine, which is also called Benadryl, is another medicine that we'll sometimes use. And then the other mainstay of treatment is spray and nose sprays. And there's quite a few out there that help with allergies. Probably the ones that help most are the steroid nasal sprays. But there's some other older ones, like with cromolyn and some with other antihistamines. And then obviously, if you can figure out what it is you're allergic to, you can do your best to try to avoid it. That's probably going to be the best way to treat your allergy symptoms and even asthma, okay? And then some kids are actually also sent to the specialist to get allergy shots to help with their allergy symptoms.
That is some very useful information, and now we'll go on to some questions. So when it comes to asthma, as you mentioned, boys tend to have a more higher incidence of asthma than girls. Why do you think that might be?
Well, that's a good question. Honestly, I don't know. I wouldn't know how to answer that. But The literature suggests that before puberty, that the boys tend to just a little bit more frequently have symptoms of asthma.
And then Latinos are actually at a higher asthma rate. They get higher asthma rates than the general population, which is also something to know, especially since we are predominantly Hispanic here in the Rio Grande Valley. Now, at what age will asthma start? Can it start pretty young?
Yeah, well, we don't like to diagnose it until they're about 2 years old. But some kids are pretty obvious. You know, they've got the really dry skin rashes. They've got parents who have asthma, and they're only a year old, and they respond very well to the asthma medicine. So someone like that may get themselves a diagnosis of asthma under the age of 2.
All right. Now let's talk about some of the main asthma triggers. So exercise, as you mentioned, so heavy exercise may induce an asthma attack.
Yes, it can. But people who like to be active, like to be in sports, asthma should not be something that keeps them from doing what they want to do.
Yeah,
okay,
you basically...
There's medications that they can take to help them do everything. There should be absolutely no limitations on them whatsoever. There's things that they can take in order to help them with that process.
Another common trigger is cigarette smoke. So I know that there are people who still smoke, and having any smoke, is it dangerous even having the smoke? You go and you smoke outside to avoid, you know, your child being in the room, but then you come in, even that after smoke, the smell, can that still impact their asthma?
Absolutely, absolutely. I mean, it gets on your clothes, it's everywhere, you know, it's secondhand smoke, and it's probably the #1 trigger of asthma, and it makes asthma worse.
And then changes in temperature, obviously, so the weather can play, you know, a role, especially when we do get those cold fronts that come in. You may see some issues, or you may see some issues with extreme heat as well. Is that right?
Yeah, especially with a cold, and we'll even see it in the ER. In the ER, when it's cold, the asthma kids come in much more frequently than when it's warm outside.
And then strong smells. So that's something that you really need to think about, because I know I like to wear cologne. I probably do 1, 2, 3, maybe 4 sprays. But if you have kids, you have to make sure that essential oils, aromatherapy, those kind of things, you have to make sure that you're watching out for your kids and making sure it's not impacting their health.
Yeah, I mean, sometimes you can tell if they're can be allergic to those kinds of things, and obviously if they are, you want to try to avoid that as much as you can.
And then obviously you have pet dander, things like that you hear about as well, that can be a trigger. So those are unfortunately hard conversations that parents have to have with their kids about it may not be the best idea to have a pet in the home.
Right. In particular, cats. Cats tend to cause a lot of allergies. But you know, I'm a pet lover. I like pets, so I'm probably allergic to them too, but you know, there's things that you can do to help you keep your pets if you want to.
Now, when it comes to the medical treatments for it, obviously you have the inhaler that everyone knows about. But what are the differences between? There are different types of inhalers. Is that right?
Yes.
And it's important that you are obviously using the correct one for the situation. Right.
And with the help of your doctor, you should be able to learn which ones are more appropriate. In general, the one that is used whenever you start getting sick, when you start coughing, is called albuterol.
Okay.
And it comes with as an inhaler. Generally, we recommend that they use it with a spacer, which is a little device that hooks onto the inhaler. It just tends to help the medicine get to your lungs much better. And that one, or there's also nebulizer machines, which are very common device down here in the valley. And you can administer albuterol that way too. The albuterol is the one that helps with sudden attacks or worsening attacks. There's other inhalers, like you had mentioned. There's different ones. The other ones are usually the steroid inhalers that are actually there to help you prevent from getting to the point where you need to take the albuterol.
So that inhaler would be the controller, right? The one that would help you prevent.
Yes, some people call it a controller medication.
And
the controller is the one that you have to take every day.
Okay.
Okay, the albuterol is one that you only take as needed.
And that would be what you call a reliever. So that's
Yes.
the one where that is preventing an attack, not preventing just a reaction. When you're in a severe attack, it's providing rapid relief.
Yes, exactly.
All right.
Exactly. Tom.
And then there are Are there a combination medicine that kind of combine the two?
Yes, there are. Those are more on the newer side. They're not that new, probably within the last 10 years, but we don't see too many folks on them down here. But they'll probably start coming to where they can use just one inhaler, and they're designed to be used similar to how you would use a controller and a reliever, but in one inhaler.
Okay. And I know that there have been instances where children end up in the ER because they've used the wrong inhaler, especially if you're talking about a reliever that's supposed to give you rapid relief and you're not having an asthma attack. That can actually be potentially dangerous.
Yes, yeah. It's really important to know which medicines are for what. It's, I mean, you would think it's not that difficult, but I mean, sometimes it can be. Your doctor can actually create what's called an action plan, which is on a piece of paper. It tells you which inhaler is for the controller, which inhaler is for your reliever, how often to use it, when to use it when there's certain symptoms, and it's called an asthma action plan, and those can be put together by your doctor.
And obviously, in a medical emergency, your child is having an asthma attack, and you're reaching in for a bag that has all of these. There could be some confusion with that. So labeling is always a smart thing to just, if you want to put a label on the actual device, just so that way you know this is for emergencies and this is for preventing an issue.
Yeah. It's certainly a good idea. Even if you want to put on the label reliever and controller, that's totally fine. Whatever helps.
Now, when it comes to asthma, is there a risk that your asthma will get worse as you get older?
It's usually, Tom, it tends to get better as you get older.
Okay.
Most of the kids who start out with asthma tend to outgrow it. There's very, very few kiddos that keep having asthma into their adulthood. That definitely happens, but a lot of the kids that we see will actually outgrow it.
Are there any medications that could possibly trigger asthma, like taking too much aspirin or a beta blocker or something like that?
Not in particular, unless you're allergic to it.
Okay.
Then that could possibly do that.
And then obviously the weather can trigger issues with asthma. We've been having very windy days here in the valley this whole week. What is your advice, especially for preventing those kind of issues? Like just making sure that if you're going to go outside, what can we be doing to protect our kids?
Yeah. Well, I mean, certainly keep them on their medications. We can't change the wind, right? But there's not really a whole lot you can do except making sure that they're taking the medications the way they're supposed to and looking out for the symptoms of them getting worse.
Can a person die from asthma?
Well, certainly. It's very uncommon. Very common. I don't think I've ever seen it in the 30 years I've been doing this. Maybe I've seen it once, but it's uncommon. We have a lot of ways to treat asthma, even very severe asthma in the emergency room, and we, oftentimes the ones that are very, very sick will be admitted. They can be admitted to an ICU where they get watched very closely, or to the pediatric floor. But yeah, the idea is to bring them in before
Right
they get to a point where they're like that.
But and obviously taking all of the steps you can to prevent any sort of asthma attack. So avoiding those triggers, making sure you understand your child's triggers. What advice do you have for tracking those triggers and for making sure you speak with your pediatrician about it? I know journals always come in very handy to write down. As you notice something, write it down, because you may forget when you go to the doctor's office.
Yes. And sometimes you can actually tell what triggers they are. And sometimes your doctor may actually want to confirm that by sending you to an allergist to say, hey, you know what, I think you might be allergic to cats, or I think you might be allergic to, peanuts, or, things like that, where they can actually confirm those kinds of allergies.
What are the telltale signs that you are about to experience an asthma attack? Like, what are the things that a parent should look out for? Like, these are the things that as soon as you start spotting this, you know to go get that reliever.
Yeah. Well, the very first thing, Tom, is a cough.
Okay.
Very simple. It's a cough. Okay. Once they start coughing, that's probably when if you have a child with asthma, when you should probably start giving them their reliever medication. And if you start noticing that the reliever is not helping, even after giving it every 4 to 6 hours, then you really should consider bringing them to the hospital.
How do you properly use an inhaler? I know that it seems pretty simple. I believe you just put it to the mouth and then you squeeze a couple of times. But what advice do you have when you're talking to parents about how to properly use an inhaler?
Yeah, well, I always tell them, regardless of the age group, to use a spacer with it or an aero chamber. It's a device that hooks into the inhaler, and it helps deliver the medicine much easier into your lungs. When you push that inhaler, it goes into your mouth rapidly. Most of it will sit in the back of your throat. But if you put it into the aero chamber, you're able to breathe it in much better and directly into your lungs. So.
Now, when it comes to lessening the impact or preventing an asthma attack, awareness is key, right? So talking to your doctor about the child's symptoms and making sure that your eyes and ears are always open.
Yes. And there are, Tom, actually there are different levels of asthma that your doctor will determine. And based on the severity of the asthma, there's different recommendations on what kind of medications to use to treat that level of asthma. Another
key piece of advice is to trust your instincts as a parent. So if your gut is telling you something is not right, make sure you seek help right away.
Yes. I always tell that to parents, especially with breathing. I say, if you're worried about your child's breathing, bring them. We'll check them just to make sure that they're okay. All right, but yeah, especially with breathing, they should definitely get them checked out.
And knowing those triggers is going to be key. If you can avoid those triggers, that's the best way to avoid an asthma attack.
Yes, absolutely.
Now, when should a parent ask for a referral? Will they ever have to see a specialist, like let's say a pulmonologist or an allergist or immunologist? When would that happen, or is it mainly done with a pediatrician?
Yeah, well, pediatricians are trained to take care of asthma of all severities. The kids that tend to be admitted multiple times or have to, be admitted to the intensive care unit several times, those will generally send to the pulmonary specialist.
Okay.
And that way they can help treat their severe asthma.
All right. Now let's move on to allergies, which I grew up with, and so I've been living with allergies my entire life. Is it safe to take a daily allergy medicine?
Yes, it sure is. And those with even moderate to severe allergies, not just an oral medication, Tom, but also nasal sprays are very, very helpful in treating asthma. Treating allergies.
Okay. And what's the difference between taking the daily pill versus taking the spray? Because you see brands like Flonase on the market, which has now gone generic, and you can find it at Target as a generic brand, let's say. But what's the difference between taking the pill and doing the spray?
Yeah. Well, the pill is usually an antihistamine. So histamines are the substances in your body that cause a lot of allergies, and so taking an antihistamine will kind of block that effect and help with your allergy symptoms. The nasal sprays are actually anti-inflammatory medicines.
Okay.
So most of the time with allergies, in your nose there's a lot of inflammation in the inside of your nose, and treating that directly with medicines like Flonase or fluticasone. There's several other nasal steroids on the market. They help a lot with that nasal congestion.
So you could feasibly take your pill when you're just as your daily maintenance so that you don't have any issues come up. But then if you are experiencing some sort of a reaction, I know I've been in homes where there's a cat and I'm allergic to cats, and I start getting the symptoms. That's when the air spray, the nasal spray, will help.
Yeah. Well, the nasal sprays actually, Tom, are kind of like a controller medicine.
Okay.
They're meant to be taken every day.
Okay.
And it's usually very easy. It's just one spray once a day.
And you can do both and you're fine.
You can do both and you're fine.
All right.
And they also make antihistamine nasal sprays, which would be good in that scenario when you're around a cat all of a sudden, and that's for like an as-needed type of nose spray.
So it's obviously knowing the difference between the two, so you're reaching for the right one when you're having some sort of a reaction.
Right.
Now, can you create, similar to an asthma action plan, an allergy action plan?
I imagine so. I've not seen one, but allergies tend to be a lot easier to treat than asthma. And usually it's a once-a-day regimen of medication that will help most of the allergy symptoms.
And most of the allergies that we were talking about today are more environmental per se, but there's also the food allergies that people may have and things of that nature, right?
Yes, yes. And Tom, those tend to be more serious. The food allergies, bee stings or insect stings, those can lead to really awful reactions. And many of those kids will actually at home have what we call an epinephrine pen or an injection of epinephrine in case they get real sick with trouble breathing and vomiting when having a reaction to that.
And if you'd like to learn more about the food allergies, we did do a Let's Talk last year on food allergies, so you can visit sthsletstalk.com and you'll be able to see that webinar. So there was some great information for food allergies. Now, when it comes to treating it, obviously avoidance is key. So we want to make sure that you avoid, again, any triggers, just like with asthma.
Right, right. Definitely.
Want to make sure to do what you have to do to avoid them. And then medication, when it comes to medications, are there any that we should be careful with that may trigger some reaction?
Not really. I mean, some kids do have allergies to medications. That's a common question that actually gets asked every time you see the doctor. Are you allergic to any medicines? Okay,
Yeah.
Obviously you don't want to give him those medications, but in general, those are very well known and pretty much avoided.
And we hear a lot about immunotherapy. What exactly is immunotherapy?
So immunotherapy is when you get the, most of the time you get the injections, the allergy shots. And the idea is they introduce whatever it is you're allergic to in a very slow fashion and to let your body, counteract that allergen. So it could potentially keep you from being allergic to whatever it is that they're trying to keep you from being allergic to.
And then there is the skin test that I know that I remember when I was younger, and they give you the skin test and they basically check you for everything that you might be allergic to.
Yes.
It's just like the panel. When would a child be able to get one of those done? At what age?
Generally, so I'm not in primary care, but I would think if older than 2 and if someone with severe allergies and the parents really want to know what it is they're allergic to and what it is that they could avoid, I would say a little older than 2 years old. But the kids that young, they will not like that.
Yeah, I can only imagine how uncomfortable that would be for a child.
I would think it'd be in the older age group.
But that may be something that if you're just really you can't figure out what may be causing an issue, you may want to talk to your pediatrician about a possible skin test.
And they do actually, Tom, they do have blood tests now for that.
Okay.
So you don't necessarily have to go through all that skin testing, which I did also as a kid. But they do have some newer blood testing available, but it's for specific allergens. So you kind of have to figure out which ones that you're looking for.
But again, if you're writing down, you're taking notes, you're seeing, I'm noticing this reaction whenever my child is near A, B, C, or D. That's a good conversation that you can have with your pediatrician, and then one of them may be a blood test that you can take to confirm your suspicion.
Exactly.
Can you outgrow an allergy?
Probably. I mean, I would think so. But you and we've had allergies all our lives.
We have. I've been dealing with them for a long while, and it's pretty annoying.
In general, though, as someone who is allergic to, like, say, a bee sting or allergic to a food of a certain kind, that's with them forever. But I'm certain a few of them do kind of outgrow it. But it's something they got to be careful with their whole life.
Now there are some questions that we have from the audience. So is asthma likely temporary or chronic? So we've talked about it, and it's basically chronic. You may outgrow it as you get older. But
as you get older, you tend to outgrow it, but it can be a chronic condition even into adulthood. I don't take care of adults, but I imagine quite a few adults come in with asthma also.
And what is your advice if you're going to be traveling with your child? You're about to set off on a plane somewhere. What should they have handy in their travel bag?
Well, they should have their medicines. They should take their medications. not just traveling, but if they're going to grandma's house, they should take their medicines with them in case they need them. So it's very important to have your medication. I mean, there's certainly ways that you can get medicines if you really need to, but it's just so much easier if you just take them with you. Mm-hmm. And in that, the one thing that I will tell you about, Tom, is some of the medicines are big and bulky, like nebulizer machines. It's hard to travel with something like that. Mm-hmm. But even a younger child, such as age 2 or a little bit younger, can use an inhaler as long as they use it with an aero chamber. Okay. There's ways for them to use that. So it's much, much easier to travel with an inhaler.
So speak with your doctor and figure out, I'm going to be traveling, what can I do to prepare for this trip, and what medicines can I bring that won't be so bulky, that can get through security, and you don't necessarily have to check a whole bag.
Exactly.
That's a big suitcase for an entire nebulizer, I think.
Right.
Now, if you are traveling, and obviously we should be paying attention to the weather. So you can be looking, if you're going somewhere that may be colder, it's a good idea to kind of just always check the weather ahead of time. And that's something that you can easily find on weather.com.
Yes, or even, the weather apps, all of them. Mm-hmm. They can even tell you how much pollen is in the air.
Those pollen readings are really important. I know as soon as I get to Austin, I start reacting, because there's a pollen in Austin that I don't know what it is, but it definitely affects me in Austin. Okay. That it doesn't affect me here. Now, are there seasons for asthma and allergies? Like you hear about seasons with like the flu and things like that. Are there kind of some peak times when you see it the most?
Yes, I would say most of the time in the wintertime. We'll see. Around the time when we see all the most of the respiratory infections, like the flu and RSV and all those things. But there's probably another peak in the spring, mm-hmm. when all the green buds are coming out and all the pollen is out. We get another peak during that time also. Mm-hmm.
Now, what is your final takeaway for parents? What do you want them to leave this webinar with? What advice do you have for them?
Well, the biggest thing I would say is, if your child does have asthma, the very first thing to look out for is the presence of a cough. If they start coughing, then start really, focusing in on them. Make sure that their breathing is okay. Go ahead and start giving them their inhalers, the reliever inhalers. Okay. Generally, every 4 to 6 hours, and keep giving to them when they're coughing until their cough goes away. But then, obviously, if you're concerned about their breathing and how they're responding or not responding to the reliever medication, then get them checked out by somebody in person.
All right. Well, thank you, Dr. Cantu. That was all very great information that I'm sure parents will benefit from today.
Okay. No problem. Thank you, Tom.
All right.
I appreciate it.
And that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize the health of your children, and we look forward to seeing you for our next installment of this Let's Talk Children's Health webinar series on Wednesday, April 16th from 5:30 to 6:30 p.m. when we discuss autism. Like and follow the STHS Children's Facebook page for more details on our future Let's Talk Children's Health webinars. And to view all of our previous Let's Talk seminars, all you have to do is visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health and the health of your little ones.
At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's,
where kids come first.